These are the major events that occurred from 2011 through 2021.
To begin our historical timeline, I'm going to give a brief overview on how the field of occupational therapy has developed in the last decade. In 2014, Hawaii became the 50th state to pass legislation on occupational therapy licensure, which made it standardized in all 50 states and 3 jurisdictions. The administration of the Excellence in Mental Health Act resulted in occupational therapy being included as one of the professions that can be covered under the new Certified Community Behavioral Health Centers. The AOTA also adopted the 3rd edition of the OTPF, otherwise known as the Occupational Therapy Practice Framework. In 2015, New York State passed OTA licensure, becoming the 50th and final state to pass legislation about standard OTA practice. To continue, in 2016, the AOTA adopted Vision 2025. This states that occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. The AOTA also attained a membership high of 60,000 members. In 2017, AOTA celebrated its 100 years of the association and also of the occupational therapy profession. Now, a master's degree or higher is required to take the NBCOT, and in 2020, the 4th edition of the OTPF was accepted and adopted by the AOTA.
In the past 10 years or so, the Affordable Care Act has made several notable changes. In 2011, members are now allowed to pick their choice of a participating primary care provider for their specific needs. Young adults are now also allowed to stay on their parents' plan until they are 26. Lifetime limits on coverage is now eliminated, and customers can make appeals if they are experiencing a problem with their coverage. In 2013, people buying insurance on their own now get subsidies to aid in monthly payments. Premiums are based on income, and insurance companies are required to provide insurance to anyone who applies in the age range of 19 and 64. The Affordable Care Act also will fine everyone who does not have insurance. This fine begins at $95 and increases annually until 2016. The goal behind the fine is to encourage people to buy health insurance. In 2016, pre-existing condition insurance plans will be expiring in January 1st, 2014. Overall, more adults are now insured. However, many are actually underinsured, meaning they experience out-of-pocket and excluding premiums. In the past 10 years or so, the mental health of adolescents is drastically decreasing. Rates of major depression has increased 52% from 2005 to 2017, and this may be due to the increased use of social media in adolescents. That being said, social media has also made it much more socially acceptable to seek help for mental illness. The rates of female adolescents seeking outpatient mental health treatments has drastically increased in the past decade, and different social media accounts have been promoting mental health, aiming to normalize mental illness and eliminate stigmas. Therapists are also speaking on different platforms free of charge, thus supporting adolescents who may be struggling with mental illness.
In theory, e-cigarettes were created to be a safer alternative to smoking. However, vaping still has very harmful effects. For those unfamiliar with electronic devices, e-cigarettes heat nicotine, which is extracted from tobacco, flavorings, and other chemicals to create an aerosol that you inhale. Nicotine, as we all know, is a highly addictive substance and can lead to withdrawal symptoms if cravings are ignored. Inhaling nicotine and other toxic chemicals in e-cigarettes can weaken the immune system, creating greater risk for having bacterial infections such as pneumonia. Furthermore, there has been an outbreak of lung injuries and deaths associated with vaping. As of January 21st, 2020, the Centers for Disease Control and Prevention confirmed 60 deaths in patients using e-cigarette products due to lung injury. This vaping epidemic will continue to soar if not prevented. In fact, e-cigarettes are enticing to younger groups. They are attracted to them because they believe it is less harmful than smoking and enjoy the flavor variety. So here's a line graph that shows the use of e-cigarettes and regular cigarettes in 2019. So about 27.5% of high schoolers used vapes compared to 5.8% that used regular cigarettes. So these results go to show that teenagers are attracted to vapes, and if it is continued in the future, then health risks are prevalent. So during my research, I found that OT interventions were used in a case of acute respiratory distress syndrome. So a 19-year-old boy was admitted into the hospital due to a past medical history of pneumonia, cough, fever, and shortness of breath. The patient received 16 occupational therapy treatments over a 60-day hospitalization. The assessment measure for post-acute care, 6 clicks, was utilized to evaluate the patient's functional progression along with the hospital anxiety and depression scale to assess the patient's depression and anxiety throughout hospitalization. The patient demonstrated AMPAC scores improving from 14 to 20. This growing epidemic presents a need for OTs to provide skilled intervention in this growing patient population.
In 2018, the prevalence in America of those with obesity was 42.4%. That means 1 in every 3 adults and 1 in every 6 children suffer from obesity. Obesity can be affected by many different factors. Some of them include the environment, the individual socioeconomic status, and the culture. In 2018, the estimated annual medical cost of obesity in America was $147 billion. That comes out to be about 10% of the national medical budget in America. When an individual is diagnosed with obesity, their risk of heart attack, heart disease, cancer, type 2 diabetes, and other mental illnesses drastically increase, along with a decrease in their quality of living. In June of 2013, the American Medical Association declared obesity as a disease. With this legislation came an increase in access to treatments because physicians now saw it as their professional obligation to treat it as any other disease. This legislation also increased treatments by physicians because they are more likely to receive insurance reimbursements while billing for treatment. In addition, during this time period, there was some indirect legislation acts that occurred regarding the obesity epidemic. Most of these were public health strategies, and they targeted communities, healthcare centers, schools, and workplaces.
In 2012, they launched the Vaccine Error Reporting Program. They made this program so they could collect data on different types of vaccine errors, and they wanted to see the underlying causes for it. So from 2012 to 2016, there was 1,754 reports submitted to this. And in 2017, I just put on the slide the top causes for these vaccine errors that showed. So in 2018, they wanted to address these issues by sending out this newsletter that recommended different educational topics and teaching points for the staff who would administer these vaccines. And they also recommended preparation for immunization activities and vaccine campaigns in hospital and in clinical settings as well. I'm also going to address the COVID-19 vaccines. So I just want to talk about the effectiveness rate for both of them. Pfizer had a 95% effectiveness rate in preventing COVID, and Moderna had a 94% effectiveness rate. As of December 2020, the AOTA mentioned that they got support from the ACIP of the CDC that the OTs, the CODAs, the students should be getting the vaccination in phase 1 because they could be highly exposed to COVID from patients that they're trying to take care of. And the AOTA also mentioned that the situation is still happening. So they said they will update more of what they're going to do as time goes on.
So as we all know, this past year, the world has been affected by the pandemic of the coronavirus. And I found these main points that was a timeline of Corona and how it started. And I stopped before the fall because that's when it was all talk about the vaccines, and Grace already spoke about the coronavirus vaccine. So I won't get into that. But some of these dates I want to pinpoint because I think that they're important. Not all of them are mentioned here, but these are some of the ones that I think that are significant. One of them being the California cruise ship outbreak. And I remember just thinking this was no joke when this happened and things were going to be changing very fast. Another important one is the World Health Organization declaring COVID a pandemic, the travel ban, and producing of the vaccine. And then lastly, seeing that COVID is now the third leading cause of death, and it's just terrifying to realize. And it shows that we still have a huge health crisis on our hands, and we need to still be doing everything that we can as individuals to stop the spread. So now I'll get into COVID and how OT and telehealth are affected. So there's definitely some obstacles with providing OT services via telehealth. And there's that question if OT practitioners can utilize telehealth and continue to provide that proper service while also trying to slow the transmission of the virus, especially in the more vulnerable populations. Legislation that Congress passed only serves to ease access to existing telehealth services. And it also does not expand on the definition of who can provide telehealth services. So that is causing some conflict in the OT world. And I will now get into the specific insurance plans and how they regard telehealth during the pandemic. So for Medicare Advantage plans, they can expand their coverage on telehealth services during the outbreak without penalty or enforcement of actions from the CMS. Medicaid and CHIP programs, OT services are already reimbursed via telehealth, but it varies state to state. So you should contact the Medicaid agency to find out more about that. And for private and commercial payers, coverage for OT services varies plan by plan. And many plans are electing to stay away from the cost sharing or otherwise expanded access for telehealth services. So practitioners are encouraged to contact the plans directly and determine the plan's current policy and approach to the provision of OT telehealth services.